Alright, my name is Keyon from Academic Plus Charter, and I'm interviewing Rachel Barnes, a NICU nurse. Alright, Miss Rachel, what made you become a NICU nurse?
Well, I've always wanted to work with children, and I've always wanted to be a nurse, so I just kind of combined those together. I was a pediatric nurse for 5 years, and then I wanted to do something different, so I went and took care of the babies.
What all did you have to overcome? Like, what all schooling did you have to go through?
Well, I took a different track than most people. You can do a traditional 4-year program. I went to Baptist, and I did my LPN first, my licensed practical nurse first, and worked for 2 years, and then went back to school and got my RN, which took another year. So for me, it was a total of 2 years. And then now I'm actually back in school to get my degree because I graduated from Baptist, which was a diploma.
Cool. So how long have you been working this job?
I've been at UMS in the NICU for 5 years, but I've been a nurse for 12.
Cool. And where did you graduate?
Baptist.
Baptist?
Yep.
Cool. Would you want to further that into being like a practitioner? Maybe?
I really enjoy being at the bedside and working in a hospital. Right now in my career, I do not see, I'm going back to get my degree and to get my BSN, but I do not see myself furthering that anymore. But, in 10, 15 years, I may change my mind.
So for a NICU nurse, they always have to take care of the babies that's in need, the infants that are in need. Like when I was younger, I had a problem with milk, and I had almost died. So maybe I had to see a NICU nurse too. So is that true? Like that's the only thing. That's the only thing y'all have to the little infants. That's what. The only thing you have to work with?
We take care of them from birth until we discharge them or transfer them over to the hospital. Usually, I think the oldest infant we've had in the last couple of years has been 5 months old, and then they got to go home. But yeah. So
that's the oldest. That's the oldest they can go to.
No, it can go up until they can go home. But I think typically they either get to a point where they need to go to children's for further studies and all that, or they get to go home.
So where do you work?
At UMS.
UMS?
Yeah.
How many days do you work?
I work 3 12-hour shifts. And it's just kind of random days. We have a kind of a rotating schedule, and I'm required to work 1 weekend a month. But it's nice to have 4 days off.
Yeah, it's cool. What's the most important thing about your job? What's the most important thing that you do?
The most important thing is always safety and making sure that you're doing what you're supposed to do. But just taking care of the babies is very important. Making sure that they're fed, and if they're getting sick, you can recognize that.
How often do you get a smile from those babies?
Not a whole lot, because they're developmentally not to that point.
Okay. Some of them can't. It's a possibility that some.
Every once in a while you do, but
yeah. And have you ever saved one that was in a very bad condition?
I don't know if I would say saved, but I've definitely had babies that were on 12 different kinds of IV medicines, and we were pushing blood and different drugs, and it's a team effort, and with the doctors and the other nurses, I've had days where I barely had time to go eat a snack in that 12-hour shift. But I don't think I personally saved anybody, but I've helped the group save a baby.
So what was the purpose of you picking this job?
the purpose. Like I said, I just wanted something different from pediatrics. I love children, and so I just wanted to go somewhere different.
Cool. What all type of diseases can they come in with?
I mean, they can catch anything from that the mom has. We see all kinds of stuff. And then, you always worry about getting a hospital-acquired infection. Sometimes if they have siblings, they can bring in colds and RSV, which is very serious for preemies.
I'm glad you brought that up. So what about the babies? Like, do you have to deal with the infants that has parents with, like, drug abuse backgrounds? And, like, what is that like?
It can be very difficult. Babies that withdraw, they are very hard to console. They can keep you busy. It's hard to take care of an infant, and because you also take care of the family regardless of their situation, and you have to make sure you're not judgmental, and you take care of everybody's needs regardless of how you feel about the situation.
How many infants are there in the ICU?
Our ICU can hold up to 67 babies. Typically, a nurse's day, depending on what area of the NICU you're in, you can have one baby up to 4 babies. And it's like the 1 babies are the ones on the ventilators and very sick and probably really little, and then it kind of goes up to what we call our feeder growers, which are just babies that are off of oxygen, don't have IVs anymore, or just learning how to eat and getting big enough to be able to go home.
How many other NICUs are with you?
How many other NICUs?
Nurses.
Children's has one, St. Vincent's has one, Baptist has one, and I think there's a couple of smaller ones throughout the state.
Yeah, because you're not the only one in the ICU. It's like putting it up more.
Yeah.
What was the worst experience you ever had on the job?
I've had, like I said, the babies that are sick, and you know that they're sick, and they are horrible. Like, they get really, like, a baby that started off this big, maybe this big with all kinds of fluid, like, because they can't get it off. And probably the worst thing is just, taking care of these babies and knowing that there's a possibility that when you leave, they could die during the night, and you come back in the morning and they're gone. Or
have there ever been a baby that died while you were pregnant?
Yes.
And it's not a good experience. I know that from any living thing.
It's not, and there's different environments too. Like, you have a baby that is going to die. It has a condition that is not compatible with life, and those are not easier, but you can help the parents take care of that baby and just help that baby be comfortable and do things for them, versus a baby that was fine and then all of a sudden got sick, and like the parents are going, what happened? And that's hard. But it's all hard. But
what all equipment do you have to use there?
We have different kinds of ventilators and IV pumps and chest tubes and breathing machines, CPAP and oxygen and feeding tubes, all kinds of stuff.
Has there ever been any changes as far as like how long you have worked, like ever since when you first started? There's
always changes. Something comes out every month that's different, and we have to adjust and learn. And new studies will come out saying one thing, and you have to change how you do things and protocols.
And is most of the new things easy to work with, or it takes a lot of time?
Most of the things are pretty, like, it may be just a change in one or two things that you do. So it's usually not bad.
And what all What all days are you required to be?
Like I said, I work 3 12-hour shifts. We have at UMS, you have to work a weekend shift, and then you just work 3 12s.
Oh, are there any babies or any infants in there that doesn't take? Do they all like take the same type of milks, or they all have different?
Pretty much you always try to give the little babies less than 34 weeks breast milk, whether it be mom's or donor breast milk. And then as they get closer to term, like 36, 37 weeks, if mom is not producing breast milk or didn't want to do breast milk, then they'll transition to formula. And they will usually always start with the same formula and then kind of change it based on the baby's symptoms or issues.
I've never heard of donor breast milk. Can you tell me about that?
Donor breast milk, there are banks all over the United States that will take breast milk from moms that overproduce. And they go through very strenuous testing, and they can't be on a lot of meds, and they have to go get blood work and all that kind of stuff. But sometimes moms will produce a whole lot of milk, and they only have one baby, and so they can send it to them. They will pasteurize the milk, and then they can send it out to the different NICUs and give the babies breast milk, because breast milk can help reduce the risk of infections in the baby's intestines, and just is better for them, easily more digested.
Can an infant be born with any tumors?
Mm-hmm.
How? I only thought tumors go for most athletes get tumors and everything. I didn't know that it can happen. I heard of one called Wilms tumor.
Mm-hmm. Yeah.
And how can a tumor be developed in an infant if it's just born?
Just somewhere in the process of developing in the mother's womb, something went wrong, and they get tumors.
If you could change anything about where you work, what would you change?
I don't know. I mean, UMS is a great place to work. I love it there. Sometimes I wish I could change the babies' situations and their outcomes, but as far as work part of it, there's nothing that I'd really change.
How many infants can you work with per week, or have you worked per week?
I mean, it just depends on all your assignment. Like I said, you can have one baby, or you can have up to 4 babies. So,
and different infants come in by the day, right?
Mm-hmm. Yeah.
Well, reproduction is a big deal. Say that.
Yes.
I'm trying to think of this next question. I got some more. How many years can you work in this job?
As long as you want to. You want to wrap up with my favorite part of the job?
Yes, ma'am. All right, what's your favorite part?
My favorite part of the job is seeing 1-pound babies born and getting to follow them from being so little and so sick to be able to walk them out with their families when they're 6 pounds and healthy, and getting to see them get to go home.
Are there any more things you'd like to tell about your job or about your career?
It's difficult, but it's rewarding. Some nights you just want to come home and crawl into your bed and not get out again, but then you have the babies that you get to love on and get to send them home with their family after months of being sick, and it's wonderful. So,
how happy is the scene to see a baby go back to his parents and see the facial expressions that his family makes?
It's amazing,
it almost makes you want to cry happy tears.
Sometimes you do. If you've been with a baby for 4 months and you've taken care of it the whole time, you do cry. But it's happy tears.
And I understand there's a lot of obstacles going through there for those kids. It's like crazy. And well, I enjoyed my time with you.
All right.
And we out.